is Ashley, and I have been living with type 1 diabetes for 21 years. When I was first diagnosed, I was a senior in high school, and I had all the classic symptoms of diabetes but was unaware of the disease at the time. It was really the rapid weight loss and these oral lesions that I developed in my mouth that brought me into the urgent care. I was told by the doctor that I had oral thrush, and if I was not on any antibiotics, then I either had AIDS, leukemia, or diabetes. When the test results came back and confirmed that I had diabetes, I was obviously devastated, but at the same time relieved that I got the most manageable of the three conditions, in my opinion. The devastation eventually turned into a stage of grief. I learned that instead of going on my senior trip with all of my best friends to the Florida Keys, I instead had to learn how to manage my life with diabetes. I was trained how to check my blood sugar several times a day with a finger stick, count carbohydrates, and inject the appropriate amount of insulin several times a day, and learned how food, exercise, and stress all affected my blood sugars. The next several years was a rocky roller coaster, to say the least. Immediately after starting insulin, I regained all my weight back, and this stage of grief eventually turned into denial as I entered into the honeymoon phase of diabetes. I thought that if I ate less and if I exercised more, that I could lose weight and also avoid the need for so many insulin injections. And this led me down a very dark path of depression, anxiety, and several different types of eating disorders. It wasn't until my junior year of college, after I participated in the summer internship program at Sansom Diabetes Research Institute in Santa Barbara, that I really began to enter into the stage of acceptance of my disease. Under the guidance and mentorship of world-renowned diabetologist and researcher with type 1 diabetes, Dr. Lois Jovanovic, as well as the personal knowledge I gained from my diabetes educator, Sydney Bush, who had been living with diabetes since the age of 1, I really came to realize that you can do anything while living with diabetes. My mom's optimism and her encouragement that it's not what happens to you in life, it's what you do about it, as well as the support of all the friends and family and other people that I met with type 1 diabetes along the way, that ultimately channeled my interest in pursuing a career in medicine, specifically in diabetes. After I graduated college, I worked as a research participant and also as a clinical research assistant at Sansom Diabetes Research Institute. I completed medical school, followed by residency at Cottage Hospital in Santa Barbara, and then completed my endocrinology fellowship at Scripps Clinic in San Diego. Now, for the past 7 years, I've worked as a clinical endocrinologist and have treated thousands of patients with diabetes. I'm proud to say that my diabetes and my depression and eating disorders are well controlled, and I've really come full circle. I now work alongside the healthcare providers who first diagnosed me and treated me for diabetes at Sansom Clinic. I'm grateful that I have the personal and unique experience of living with diabetes to offer my patients compassionate and mutually agreeable care. As I too understand, diabetes is a full-time job and a very difficult disease to live with. I still struggle with it daily as I learn to balance my life as a mom, a full-time physician, and a person living with type 1 diabetes. But I have traveled the world, I have surfed and hiked around the world, ran several half marathons, got married and had 2 beautiful, healthy children, all while living with type 1 diabetes. More recently, I have circled back to Sansom Diabetes Research Institute as a research physician, where I hope to bring my clinical and my personal experiences of living with diabetes to the forefront of diabetes research. I hope to develop and discover innovative technologies, new treatments, and novel approaches to make living with diabetes easier. Looking back at the 21 years now of living with diabetes, we've certainly come a long way in the treatment of the disease, but there's still a long way to go. There isn't quite a cure yet for diabetes, as I was once encouraged when I was diagnosed, but we now have more rapid-acting insulin analogs, we have longer-acting basal insulins, we have continuous glucose monitors, and a variety of different insulin pumps, as well as closed-loop insulin pumps serving as an artificial pancreas. I'm confident that I will not die of the disease, but I will have lived a happy and healthy, as well as successful life with diabetes, and I hope to leave a legacy that I have made a footprint contributing to diabetes research. Thank you.